Public health officials around the country just can't give up their power. Take Los Angeles, where the head public health official there wants to go back to mask mandates.
If we do remain in the high community level for the next 2 weeks, indoor masking, beginning on July 29th, would expand to include all indoor spaces. Indoor areas of restaurants and bars, children's programs, and educational settings would also need to institute universal indoor masking as well.
All right. Perhaps she missed that, especially in schools, masks hurt poor kids way more than they help. Dr. Amish Adalja is with us. He studies infectious disease and teaches at the Johns Hopkins Bloomberg School of Public Health. You know, it was interesting when I was listening to her talk about mask mandates come back. She almost seemed exciting.
I don't know if I want to give her kind of motivations, but I think that it's puzzling to me that late in 2022, when we have vaccines, boosters, monoclonal antibodies, antivirals, rapid tests, that we're still reverting back to government-issued mandates as if it's early 2020. And I don't think that this type of a mask mandate is going to have much compliance. And I think it really doesn't make sense. I think mask advisories, mask recommendations, especially for those at high risk for severe disease, make sense. But I think the government using a mandate is just going to cause more people to be up in arms and create a bigger distrust level between the general public and public health and infectious disease officials than we already have.
You talked about all of the things that we have to fight COVID, and depending on whether you care about the case numbers, they're up, they're down, on and on, which will happen. Same happens with flu season and the like. I saw this screen grab from CNN. Coronavirus in the United States, community level of spread, high, medium, low. Given all of the tools that you talked about, is it time for all of us to move on from the perpetual pandemic and decide that it's just going to be with us and we're going to have to stay home when we have a cold, just like we stay home when we have the flu?
I definitely think that we have to become risk acclimatized to this virus because it's not something that can be eradicated or eliminated. It's not some hurricane that's just going to pass. As long as there are humans on the planet, there's going to be COVID-19 on the planet. And the tools that science and medicine have given us, particularly the vaccine, are what has shifted illness to the milder spectrum. So even if you see cases going up and new variants, you're not necessarily going to see hospitals in the same crisis that we saw early on in the pandemic because there's been a decoupling of cases from hospitals and crisis. We'll see hospitalizations go up, but they're manageable. And I think we have to reflect that science is giving us lots of tools that we actually have to implement, not these blunt tools and not government mandates.
Can you, I won't ask you to give her motivations, but can you explain a motivation for these big blunt tools and mask mandates and the like medically rather than politically motivated?
I wonder if many public health authorities are nervous about the cases going up. They don't want to be blamed for the disruption that cases cause, and maybe they're being held captive by politicians. I think we've seen the CDC, as you mentioned earlier, really be held captive by two successive administrations where politics was definitely infused into how they made their recommendations. The same is true for the FDA, where we saw emergency use authorizations issued basically on a president's whim. So I wonder if many public health authorities are reticent to do anything where they could be blamed for. If cases go up, things get canceled because people, maybe private organizations cancel them and they didn't have a mask mandate in place. Maybe the mayors, the county supervisors, those type of people put pressure on public health authorities. That's what I would think is the most innocent explanation for what's happening here is that politics.
So it's possible, and if you ascribe those good motives, then there you go. This is interesting. This is from Marty McCary's article in Bari Weiss's Common Sense. There's been a large amount of turnover. Morale is low. Things have become so political. So what are we there for? That's a CDC scientist to McCary and a couple of others. They have no leadership right now. Suddenly there's an enormous number of job openings at the highest level positions. That's from the NIH. COVID-19 was bad. It was perhaps not the big one. It was not Ebola. It was not something like that. You've got monkeypox now on the horizon. Is there worry in the public health sphere and among your colleagues of this loss of trust by the public in the people who we're supposed to trust in times of crisis?
I think this is the biggest long tail of the pandemic, that now there's this breach between the public and infectious disease experts, that when there is a bird flu pandemic that's inevitably going to occur. No one is going to listen to us because so much has been politicized with our messaging that many of us are subject matter experts, but got pushed into a role where we had to be authorities, and because the politicians and the elected leaders abdicated and made very poor decisions, and then the public health people get put in the middle.
Well,
and
Doc,
unfortunately,
we got to go, but you make such a good point. We will continue to listen to you and have from the very beginning been a voice of reason on all this. It's good to see you, sir. Thank you. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.